and good sense are the two greatest gifts of life, or you can say greatest blessings. Welcome to this episode of Youth Diary. Today we have Dr. Swati with us, who is a consulting urologist with KIMS Hospital, Cochin. Welcome to the show, doctor.
Hi, thank you, Deepa.
Well, it's said that 1 in 2 women get, develop this urinary infection. Is it true, doctor? And is it a serious problem?
Well, it's right that women are more predisposed to developing urinary tract infection as compared to men. This has got a lot of reasons. First, let us see what exactly is a urinary tract infection. When we say urinary tract infection, this is an infection which can develop anywhere along the urinary tract, right from your kidneys to the ureters, the urinary bladder and the urethra, from where we pass the urine out. And women are more prone to develop this because they have a shorter urethra as compared to men, and it can be easily accessed by the organisms which come from our vagina or from the stools. To answer whether this is a serious problem, most of the urinary tract infections involve only our bladder and the urethra, and they are not very complicated. Don't require many major treatment for them. But if neglected, or in a person who is predisposed to develop serious complications like a young child or an older age, or you have diabetes mellitus during pregnancy, or in any time when your immunity is low, the same infection can then go on to spread to the kidneys, or by the way of blood it can spread to the rest of our body, and it can become a serious problem.
So there is a situation when it becomes actually serious, okay? So how do you diagnose this and how do you treat this condition?
The way a patient presents to us is that the person will have very irritating voiding symptoms. That is, he or she will feel like passing urine very frequently. There will be a burning sensation in the urethra when you are trying to pass urine. You may want to pass urine but pass very few ml or a few drops of urine at a time when you attempt to pass it.
And I think it is going to be painful also.
Yeah, a very severe pain, burning pain in the urethra, and you may even have a pain in the lower abdomen or in the perineum, that is the part where the urethra opens out. And along with that, you may find that your urine is smelling strong, offensive odor, or you may see some turbid urine or some blood in the urine. So this is the time when a person should consult a doctor, maybe a general physician practitioner first, and then get referred to a urologist for proper treatment. And once a patient comes to us, we would do investigations, that is, we would ask them to collect a sample of urine for us to see under the microscope and see whether there are any pus cells, blood cells, and obviously if bacteria can be seen in under the microscope. Following this, we would like to culture it in special media and see which is the organism which is growing. So appropriate antibiotic can be started for this particular organism. And very often we would like to do an imaging study, that is a basic ultrasound investigation, wherein we would image the entire urinary tract from the kidneys to the bladder to see that there is no abnormality in this urinary tract, or there are no stones or anything else which may be causing the person to develop infection, urinary tract infection.
I think, more than this, what we get to hear is about the kidney stone. This thing. So how do we prevent that? Mainly because I can see that like we talked about the urinary infection, tract infection, I think every one man or 1 in 2 women would have this problem even. So how do you really prevent that, and what is it exactly?
When we speak of renal stones, that is deposition of materials within the kidney which then grow in size to develop a stone. We have seen over the years that it was more commonly seen in men compared to women, but today we are having a lot of women also coming to us with a stone disease. This is probably because of the change in lifestyle that we are seeing, and because of our professional needs or because of the climate, we tend to drink less water over the day, and that makes us pass a concentrated amount of concentrated urine. At the same time, consuming a lot of refined foods wherein we have a lot of animal proteins, this is metabolized and excreted in the urine, and this causes the concentration of uric acid sometimes to be high, which can again precipitate to develop stones. Now, prevention of kidney stones is very important because once a person develops a stone, there is a predisposition to developing a stone in future. So dietary control and fluids, these are two main things. Fluid consumption is very important because when we consume a large amount of fluid, we will be passing a diluted urine and flushing out these small stones or crystals which form in the kidney before they can grow on to develop larger stones and cause problems. At the same time, we require to do some blood tests like calcium, uric acid tests, and in some patients a 24-hour urine analysis to see if this person is having any particular cause for developing these stones. In these patients, you have to take a treatment which is directed towards the cause that is found. If we find that the blood investigations and the urine tests are within normal range, then our diet plan is what is given to the patient, wherein he is asked to limit the intake of proteins, that is fish, meat, chicken, eggs. They have to limit consumption of certain vegetables and nuts, ground nuts, our cashew nuts, then spinach, rhubarb, strawberry. These are the fruits which have got high amount of uric acid and they can go on to develop stones. They have a myth that people say stop on dairy products, decrease milk intake. That is not true. You have to consume good amount of milk. You don't have to stop consuming milk products, but be cautious in taking any calcium supplements which can increase the amount of calcium that you are taking. If this is done, especially consuming enough amount of water, then you can prevent your chance of developing a second stone or probably a first stone in the first place.
Okay. Sounds interesting because I think all that you have to do is just take care of your diet, have more water and lead a healthy life. That's the best thing. Yes. Well, doctor, we have few questions from the audience side. The first question is this.
Hi, my name is Meka. I am coming from Kalmasheri and my question is, how can we prevent the urinary tract infection?
Prevention of urinary tract infection is very important. The first thing that one needs to do is drink large amounts of water. When we say large amounts, around 2 to 2.5 liters of water consumption a day is very important. Other than that, we have certain basic things which you can do. Like for a female, she can make sure that she passes urine every time she has a sexual intercourse, because that way you will flush out any organisms which are entering the urethra at the time of this intercourse. Secondly, when we wash our private parts, it's important that you wash or wipe from front to back rather than from back to front, which way the organisms from the rectum or the vagina will not be colonizing your urethra. Thirdly, avoid using any sprays or any deodorants in the private area, because that causes irritation and which can go on to lead to development of urinary tract infections. Again, in a female who is trying to use birth control methods, avoid using diaphragms or unlubricated condoms or spermicidal jellies, because diaphragms are the site where there can be a lot of organisms which can grow, and unlubricated condoms and jellies can cause irritation and small erosions which can allow colonization of organisms. Using cotton underclothes and avoiding wearing tight jeans or tight clothes is also important, because that again causes a lot of humidity, and especially in our coastal area where we have a lot of humidity, using cotton clothes would be best to prevent urinary tract infection. Apart from that, some people are predisposed to developing urinary tract infection. So in these people, if they have having recurrent episodes of infection, then it's important that we find out what exactly is the cause, and that could be some medical cause or a congenital abnormality in the urinary tract which has to be found out, and that has to be taken care of to prevent developing further infections. In some instances, after everything, we still don't have a definite cause, but they go on to develop recurrent infections, and in them we do prescribe prophylactic antibiotics, which could be a small dose of an antibiotic to be taken over a prolonged period of time to prevent infection, or a proper course taken when the person feels the first symptom rather than waiting to get a culture done.
This is the next question.
I'm Aishwarya. I'm coming from Kalmasheri and my question is for you that what is urinary incontinence in women?
Urinary incontinence is a major issue in women, but we see that very often women don't come forward to express this problem, because they feel embarrassed at accepting that they have a leak of urine. And very often we find that these women feel uncomfortable approaching male urologists to get themselves examined and treated. Urinary incontinence is involuntary loss of urine. It can be as simple as passing a few drops of urine when a person coughs, laughs, sneezes, or tries to lift any heavy weight. or it can be a severe urge to pass urine, and by the time the person manages to reach the toilet, he or she has leaked. That can be very embarrassing, and as a result of this, he or she tries to avoid traveling, going to social functions, and it can really affect your life. Incontinence, when we speak in scientific term, we classify it as a stress incontinence, which I told you is on straining, and urge incontinence when it happens with an urgency. And these two are two different situations and two different conditions which require to be evaluated and treated.
Well, this is the next question.
Hi doctor, I'm Arsha. I'm coming from Edapalli, and my question is, are there options other than meditation to treat urinary incontinence?
There is risk for developing urinary incontinence in some females. Let us first see why we develop urinary incontinence. What happens is that there are muscles which support our urethra and the bladder, and that prevents urine from coming out whenever we strain or we cough or we laugh. In women where this support becomes weak, which could be because of repeated childbirths or because of any surgery that has been done in the area of the in the perineal area, or any heavy weight lifting or repeated coughing, some continuous increase in this abdominal tension. In these situations, the person is going to start leaking urine. So these women with multiple childbirths or previous surgery are at definite increased risk for developing urinary incontinence. At the same time, we find that urinary incontinence is also seen in young women who have not had any of these problems, and these could be a functional voiding dysfunction which results in an overactive bladder, wherein the bladder is overactive, and as a result of which there is a severe urge to pass urine which comes frequently, and she ends up having urinary leak. We also find an increased episode of leak in women in older age as they approach the menopause or they are postmenopausal. The hormone levels which are required for the good strength of these muscles and the mucosa of the urinary tract becomes less, and then the female goes on to develop urinary incontinence.
Well, doctor, coming back to the kidney stone problem, I wanted to understand, when is it that we have to go to a urologist to understand when is that stage when we have to get it consulted?
The symptoms which a person can present with when you have a stone is you will have a sharp stabbing pain in your back, that's below your rib, the flank area which we say, which may be radiating anteriorly and down to the lower part of the abdomen on either side. And this is very often a very severe colicky pain, and it is said that renal colic is probably second most severe pain after labor pain. It can be that severe, and the person finds it very difficult to sit in one place, is uncomfortable, probably rolling in bed, and this pain is very often associated with nausea and vomiting, maybe multiple episodes of vomiting. And as the stone starts moving down from the kidney down to the ureter, there will be an increased sensation of wanting to pass urine again and again, and you may find the person may not be able to empty his bladder, may just pass a few drops of urine. That's called as strangury. And you may have sometimes associated blood in the urine or a turbid urine, or sometimes this person may even pass out small stones which he may feel which coming out of the urethra. So this is the time when a person should consult a urologist to get investigated and diagnosed.
Now, this being a very, very common problem, the kidney stone disease, I would like to know, in fact, I would want you to tell the audience about the treatment options available, so that they can stay away from that, and if at all get it, they can get cured as well.
When we suspect a person is suffering from a renal stone, first we ask the person to undergo certain blood investigations and urine analysis, because in the urine we will see that there are a lot of red blood cells, that's blood cells which are there, which indicate that probably the person is having a stone. Then we go on to do an ultrasound examination of the abdomen, where we will see the kidneys, the ureter and the bladder for presence of any stone in any of these locations. Sometimes it is difficult to find a small stone when we do an ultrasound examination, because there is a lot of gas which may be covering it and make it difficult to detect these stones. So the best investigation, or the investigation of choice which we would say, is a CT scan of the abdomen and the pelvis. This CT scan is done ideally without a contrast when we are suspecting a stone, when the person comes in acute pain. We can exactly locate the site of the stone, what is the size of the stone, is it causing any obstruction to the flow of urine from the kidneys to the bladder, and is there any infection of the kidney or the surrounding areas. Because any infection associated with stone can be very dangerous, and we need to go in and treat very vigorously. Once we have diagnosed where is the stone and what is the size of the stone, then we have multiple options for treatment. The most basic, first option is a conservative management, wherein a small stone, maybe less than 5 millimeter or up to 5 millimeter, we know is going to pass out on its own. We just have to make sure that the person doesn't suffer from pain and the passage is easier. So we give them painkillers, analgesics, a small antibiotic if we are suspecting some infection, and there are drugs which help in relaxing the ureter and easy expulsion of stone, like alpha blockers. So this is the first line of management which is given to a person with a small stone which can be passed out. If the stone doesn't get passed out, or if the stone is a larger stone or causing an obstruction to the flow of urine, then we do a endoscopic procedure. Nowadays we don't have to go ahead and do any open surgeries for small stones. An endoscopic procedure is what is the most advised procedure, wherein we put in an endoscope, it's like a telescope with a light, through the urinary tract, through the urethra, into the bladder and up into the ureter where the stone is blocked. And we will break the stone into multiple small pieces with a lithotripter or a laser, and this is removed out, and a small tube called stent is left in for the urine to flow out easily. In case of stones which are in the kidney, you can even do something called as ESWL, extracorporeal shockwave lithotripsy, wherein we don't even enter the urinary tract by an endoscope. There is a special machine wherein the patient has to lie down, and using shock waves, these stones are broken into multiple small pieces and they get passed out by themselves along the urine when the person is voiding, and we will give some analgesics to avoid pain. In case of a larger stone in the kidney, these methods don't work. Then we have to go for a small incision at the back of the person, wherein we put in a scope from there and we break the stone. This is called as a PCNL or percutaneous nephrolithotomy procedure. If none of these work, then we have to go for open surgeries, which is quite rare as of today's time. So this is the last option which we have to keep in mind.
Well, doctor, coming back to the urinary incontinence in women again. I mean, are there treatments available for this as well?
Yeah, we have treatment. Normally we start off with a lifestyle modification, wherein the person is taught about double voiding or timed voiding, when you go and void at regular intervals. You basically called as toilet training. You train the person to void at regular intervals, avoid consuming a lot of water probably in the night time or when you are traveling, to change your dietary habits, have a lot of roughage so that you don't get constipated. Then next is the level where we teach them certain exercises. These are called as Kegel's exercises. So these exercises are meant to strengthen the muscles around the urethra so that there is no leak of urine is decreased or there is no leak of urine. Next level of treatment is the medications which are available, which can be tried, and if none of these work, then for a stress urinary incontinence we have sling operation or a tape which is put around the urethra to tighten the urethra to prevent leak. As far as urge incontinence is concerned, you have to diagnose the exact cause for the urge and address it.
Thank you, Dr. Swati, to come to our show. Indeed, it was great pleasure to have you here. Well, over to you guys. You can lead a very beautiful and healthy life by just practicing what our doctors tell you, because I'm sure these things are really going to help you. And you can always be in touch with us. You can send your mails to youthdiaryrosebowl@gmail.com. Till then, until I meet you next week, bye-bye.